Now we're going to do a basic assessment of the knee joint. We need to examine the knee joint, have a look to see if there's any effusion around the joint, and just check for the joint alignment. We now need to check the function of it. The knee is a hinge joint, so it has to bend and it has to straighten, but it also needs to have the strength to carry the person's body weight. I'm going to ask the patient just to go up onto their tiptoes and transfer weight one leg to the other. Now onto the heels of the feet, and now just onto one leg. Over from here, if the patient's confident enough, remove the support and just check to see all the muscle recruitment, gaining good balance. Place your foot back down. If you put your hands over on the bed, ask the patient to get a good firm support and then basically drop down into a weight-bearing squat. People with significant joint pain or restrictions to movement, they won't be willing to go too low, so it's important you give them a good base of support from which they can help themselves get back up. We're now going to check for the ligaments and stability of the joint. Over in this position, just check on the quadricep strength. Take the knee into a slightly flexed position, and I'm going to push down against your ankle if you push up against me. Push up and relax. The hamstrings press down into the bed and relax. We can check for the full end of range of movement, taking the knee into full extension and taking the knee joint up into full flexion. Small amount of overpressure just to clear the joint fully. We want to check for the stability of the joint, the anterior cruciate ligament. We can come in on the knee joint here, stabilise it and see if there's any forward translation of the joint. We can also check that in bigger patients, if we sit on the front of the foot and come in behind the knee joint, again, gaining some feedback as to whether or not the joint is loose. The medial collateral ligament is quite a common joint that gets irritated, and we can put this one under strain by bringing the joint into a loose position and applying a stress. The lateral collateral ligament, same stress but on the opposite side. Meniscal tests often involve what we call a sweep test, bringing the joint into a degree of flexion and compounding it with a degree of lower limb rotation. These tests can often prove positive if a person's got a meniscal problem.